Hello everyone, and welcome to Chapter 8 in Pharmacology, Substance Abuse. A few definitions. Substance abuse is defined as the self-administration of a drug in a way that culture or society views as abnormal and not acceptable. Drug abuse is the recurrent use of legal or illegal drugs or the improper use of a prescription or over-the-counter drugs with negative consequences. And drug misuse is the use of a drug for purposes for which it was not intended, or using a drug in excessive quantities. So abused and misused substances belong to many different chemical classes. They can be taken by many different routes, and they have in common an ability to affect the nervous system, particularly the brain. Some of the agents are obtained from natural sources. Examples of that are opium, marijuana, cocaine, and nicotine. Synthetic or designer drugs are created in illegal laboratories, and their sole purpose is illegal drug trafficking. Club drugs are substances taken at dance clubs, all-night parties, and raves. Alcohol and nicotine are the two most commonly used drugs. Legal prescription medications have become frequent drugs of misuse. And also volatile inhalants found in common household substances such as aerosols and paint thinners are also used. And of course, analgesics are misused. And these next 4 slides talk about commonly abused and misused substances. And they have a category or a column of the natural substances and therapeutic applications, if applicable. And those are, I believe, on page 84 of your textbook. And it wouldn't be a bad idea to just read through those and familiarize yourself with those, but it will not be a big part of the quiz. It is interesting in the book that it's talked about that cocaine was once used as a local anesthetic, but of course today it's illegal. And LSD, another illegal drug, now was used in the 40s and 50s in psychotherapy. And PCP was used as an anesthetic. So it's interesting that some of the illegal drugs today were previously used therapeutically. Addiction depends on multiple complex and interacting variables. And addiction is the progressive and chronic abuse of a substance, an overwhelming desire to use a drug repeatedly despite serious health and social consequences. And the variables to drug addiction include the agent or drug factors, the user factors, whether there's a history of trauma or physical or sexual abuse, and also environmental factors. Substance dependence can be classified as either physical dependence or psychological dependence. So again, substance dependence is when a person has an overwhelming desire to take a drug and cannot stop, and the 2 categories are physical or psychological. So with physical dependence, there's an altered physical condition caused by the nervous system adapting to repeated substance abuse. So the body's cells are actually tricked into believing that it's normal for the substance to be continually present. So again, physical dependence is when the body's cells are tricked into believing that it's normal for the substance to continually be present. And the associated withdrawal syndrome is when uncomfortable symptoms occur when the agent is stopped. So with the withdrawal syndrome of physical dependence is when there are uncomfortable symptoms that occur when that particular agent is stopped. Psychological dependence is when the drug causes no apparent signs of physical discomfort after it's stopped. But the defining portion of psychological dependence is that the person has an overwhelming desire to continue using the substance, despite the negative economic, physical, or social consequences. And it's often responsible for relapse. If you have a patient who's concerned about becoming addicted or an addiction to a prescribed medication, the provider should always prescribe the lowest effective dose for the shortest time necessary to lessen the chances of a dependence. So again, if a patient is concerned about addiction, the provider will want to prescribe the lowest effective dose for the shortest time necessary. And withdrawal results when an abused substance is no longer available. And the symptoms of withdrawal can be really severe. And helping a patient withdraw is best done in a substance abuse treatment facility. There are prescription drugs that can be used to reduce the severity of the withdrawal symptoms. For example, Valium is used for decreasing the severity of alcohol withdrawal symptoms. And there's also groups like Alcoholics Anonymous and Narcotics Anonymous that can help with withdrawal. These next two slides are withdrawal symptoms and signs of toxicity of select drugs. For example, the first one, alcohol. The withdrawal symptoms from alcohol include tremors, fatigue, anxiety, abdominal cramping, hallucinations, confusion, seizures, delirium tremens, and signs of toxicity of alcohol include extreme somnolence, which is extreme sleepiness, severe central nervous system depression, diminished reflexes, and respiratory depression. So these are all interesting. This is on page 86 of your book. It's one full table, table 8.2, just kind of outlining selected drugs, withdrawal symptoms, and signs of toxicity. So tolerance is something else. Tolerance occurs when higher and higher doses of a drug are needed to achieve the same response. So the definition is a biological condition that occurs when the body adapts to a substance after it has been repeatedly administered. So higher doses of the agent are needed to produce the initial effect. And tolerance occurs at different rates for different drugs. So tolerance to one drug might cause tolerance to similar substances as well. So again, if you have if a person builds a tolerance to one drug, that can cause a tolerance to a similar substance as well. And that is called cross tolerance. The book talks about an example that if a heroin addict, if someone is a heroin addict, they will be tolerant to the analgesic or pain-killing effects of other opioids, such as morphine or meperidine, because those are similar. Central nervous system depressants decrease the activity of the central nervous system. And drugs that are included in this group include barbiturates, non-barbiturate sedative hypnotics, benzodiazepines, alcohol, and opioids. And the next several slides talk about these different types of drugs. Sedatives are sometimes referred to as tranquilizers. They're prescribed mostly for sleep disorders and some for epilepsy, but there are two primary classes, barbiturates and non-barbiturate sedative hypnotics. And generally, both of these classes have the same effect. If sedatives are taken for a long period of time, psychological dependence, physical dependence, and tolerance can occur. So when sedatives or tranquilizers are taken for long periods of time, psychological dependence, physical dependence, and tolerance can occur. Sedatives generally have a long duration of action. Effects can last an entire day. And high doses of sedatives suppress the respiratory centers in the brain. So because of that, the user may stop breathing or enter into a coma. So some of the symptoms they might have are decreased respirations, tremors, decreased level of consciousness, cyanosis, and an increased heart rate. So death can actually result from an overdose, and withdrawal symptoms can be life-threatening. So these sedatives or tranquilizers can be a big deal if you're taking them in high doses or for long periods of time. So again, because the high doses suppress the respiratory centers in the brain, the person can even stop breathing or enter into a coma. And some of the symptoms that can occur are a decrease in respirations, tremors, a decreased level of consciousness, cyanosis, and an increased heart rate. Benzodiazepines are central nervous system depressants. They're widely prescribed. The main use for that benzodiazepines are used are for anxiety. Maybe you know someone who's taking a benzodiazepine, or maybe you yourself are taking it. They're widely prescribed drugs. Primary indication is anxiety, but they're also used for short-term treatment of seizures and also as muscle relaxants. Benzodiazepine abuse has several presentations. The person can appear detached, sleepy, or disoriented. Death due to overdose with benzodiazepines is rare unless they're used in combination with other central nervous system depressants. Abusers may combine benzodiazepines with alcohol, cocaine, or heroin to increase or to have an increased drug experience. And if they're combined with other agents, death due to overdose is very likely. So again, this is important with benzodiazepines. Death due to an overdose is rare unless they're used in combination with other central nervous system depressants. And in that case, death due to overdose is likely. Opioids are prescribed for severe pain, persistent cough, and diarrhea. The effect of oral opioids can begin within 30 minutes and can last more than a day, and addiction can occur rapidly. So a person can become addicted to opioids very quickly. And then there's also intense withdrawal symptoms with opioids. Some examples of opioids are fentanyl, oxycodone, and hydrocodone. And methadone is used to treat opioid addiction. Some of you may have already heard that or known that. Methadone is used to treat addiction to opioids. And again, some of the examples of opioids are fentanyl, oxycodone, and hydrocodone. And because addiction can occur rapidly, there's a lot of people that are leery of taking these types of medications. A few years ago, there was an article in the paper, actually, I think it was just a year ago, where the Los Angeles Angels pitcher, Tyler Skaggs, if any of you are baseball fans, he was found dead in his motel room, and he was an up-and-coming pitcher for the Angels. But they said that he mixed alcohol, fentanyl, and oxycodone, and he died in his motel room. He actually choked on his own vomit, but he had ingested all of those drugs. And that would be an interesting thing to look up online if you wanted more information. But again, his name was Tyler Skaggs. Ethyl alcohol, commonly known as alcohol, one of the most widely abused drugs. The economic, social, and health consequences of alcohol abuse are really high. It's classified as a CNS depressant, and effects can be noticed within 5 to 30 minutes. Alcohol intoxication is said to occur when muscle coordination is lost and mental function is affected. When a person is intoxicated, they can have tremors, fatigue, anxiety, abdominal cramping, hallucinations, confusion, seizures, and delirium. So again, when a person is intoxicated, they can have any of these following symptoms. Their muscle coordination is lost and their mental function is affected, but they can have tremors, fatigue, anxiety, abdominal cramping, hallucinations, confusion, seizures, and delirium. Chronic consumption of alcohol can have both physical and psychological dependence. But the liver is the most affected by chronic abuse. So when you're giving medications, if you have somebody who's been using alcohol or chronically alcohol abuser, you want to check to see if there's long-term damage to their liver function. And withdrawal to alcohol can be severe and it can be life-threatening. Long-term treatment for alcohol abuse includes behavioral counseling and participation in self-help groups, Alcoholics Anonymous. But there's a drug called antabuse or disulfiram, and that's given to discourage relapses. And what happens is if alcohol is consumed while you're taking this drug, the patient will become violently ill within 5 to 10 minutes. So that would be good negative reinforcement to not drink alcohol. They'll get a headache, they'll have nausea, they'll have vomiting. So it's important to tell the person that they shouldn't drink alcohol for a full 2 weeks after stopping that drug. Again, they shouldn't drink any alcohol for 2 weeks after stopping that drug because of the chances of becoming violently ill. Okay, marijuana produces little physical dependence or tolerance. Cannabinoids are substances from the hemp plant. They're usually smoked, and many of you know the street names, grass, pot, weed, reefer, or dope. It includes marijuana, hashish, and hash oil. Marijuana is a natural product, and it's it is among the more commonly used drugs in the United States. And of course, since this book has been printed, it's been legalized in several states in the U.S. One relatively unknown fact about marijuana is that it introduces 4 times more tar into the lungs than tobacco smoke, so it increases the chances of lung cancer. Chronic use of marijuana is notoriously associated with lack of motivation and loss of productivity. It does produce very little physical dependence or tolerance. And metabolites of the drug can remain in your body for months or years. So if you go in to have a drug test 2 months after you've been smoking pot, it may still show positive. And the therapeutic use, of course, is very controversial. Some of the telltale signs of marijuana use include slow motor movements and bloodshot eyes and staring straight ahead. Again, some of the telltale signs of using marijuana are slow motor movements, bloodshot eyes, and staring straight ahead. Three legal substances that are used in traditional therapies and frequently abused include caffeine, nicotine, alcohol. They're natural substances, and of course, marijuana use is really increasing. Hallucinogens cause altered state of thought and perception, similar to that found in dreams. So hallucinogens are known to produce an altered dreamlike state. They're psychedelics, and the prototype for a hallucinogen is LSD. All of these are Schedule 1 drugs, which means they have no medical use. The effects of the drugs are highly variable, but common occurrences are hallucinations and after images. Also, anxiety and confusion are common occurrences, and the person can have flashbacks. So LSD and PCP, I would say, are the 2 most common hallucinogens. But the common occurrences with the hallucinogens are hallucinations, after images, anxiety, and confusion. And interestingly enough, your book states that LSD and cocaine once were used therapeutically, but of course now they're illegal because of the increased potential for abuse. And the street names for LSD: acid, the beast, blotter acid. The book states California sunshine. But LSD is distributed throughout the body immediately after its use, and effects can last all the way up to 12 hours. Another hallucinogenic drug is mescaline, which is actually found in a cactus of Mexico and Central America. MDMA is another hallucinogenic drug. It has a similar chemical structure to methamphetamines. And this was an amphetamine originally created for research purposes, but now it's popular among teens and young adults. It's also called ecstasy or Molly. DOM is a recreational drug often linked with rave parties. MDA is called the love drug because it's believed to enhance sexual desire. PCP is another hallucinogenic drug that you may have heard of. It's also called angel dust. Produces a trance-like state that can last for days and can result in severe brain damage. It's used as an animal tranquilizer. Ketamine is what they call the date rape drug or special coke. Produces an unconsciousness and amnesia. Its primary use is as an anesthetic. And the MDPV is a synthetic drug made from a plant in East Africa that's swallowed, snorted, smoked, or injected, and it can cause paranoia, increased sociability, increased sex drive, hallucinations, and panic attacks. So central nervous system stimulants increase the activity of the central nervous system. There's a variety of family of drugs within the central nervous system stimulants that again increase the activity of the central nervous system. Some of the available stimulants by prescription are for narcolepsy, obesity, and ADHD. And they're taken to produce a sense of exhilaration. They often improve mental and physical performance. They can reduce appetite. And they can prolong wakefulness or a feeling of getting high. Central nervous system stimulants have effects similar to neurotransmitter norepinephrine. It's a hormone like epinephrine, where it increases your alertness, increases arousal, increases self-confidence, and increases empowerment. Most CNS stimulants affect the cardiovascular and respiratory activity by raising blood pressure and increasing the respiratory rate. So with CNS stimulants, you often see dilated pupils, sweating, and tremors. An overdose of CNS stimulants can be really serious, can lead to seizures and cardiac arrest. Amphetamines and dextroamphetamines were once given widely and commonly for depression, obesity, drowsiness, and congestion, but they don't really use these much anymore because of the development of safer drugs. Examples of CNS stimulants include dexedrine, methamphetamine, Ritalin, cocaine, and caffeine. This is listing the caffeine content, these next, I think, 4 slides. Caffeine content of common drugs, food, and beverages. It's kind of interesting. So, no dose, maximum strength, 1 tablet, 200 milligrams of caffeine. No dose, regular strength, 100 milligrams per tablet. Excedrin, 2 tablets, contains 130 milligrams of caffeine. So caffeine is added to some over-the-counter pain relievers. Coffee, brewed and instant, 90 to 135 milligrams of caffeine. Decaf coffee is 5 milligrams per 8 ounces. And then the comparison with tea can be anywhere between 15 and 50, depending on the type of tea you've got. And then the soft drinks. Look at that, Mountain Dew, 55.5 milligrams of caffeine in just 12 ounces. Diet Coke is 46.5. Coca-Cola Classic, 34.5, and Pepsi, 37.5. A Hershey's dark chocolate bar, 31 milligrams of caffeine. Milk chocolate, 10. And look at that, cocoa or hot chocolate has 85 milligrams of caffeine. So I think those tables are really interesting to see where you can increase your caffeine content, and maybe not always in an expected way. Nicotine is highly addictive and powerful. It's considered a CNS stimulant. It increases alertness. Of course, it's legal. Highly addictive. It's a carcinogen. And we know that there's harmful effects from secondhand tobacco smoke. One of the instructions we always give is not to take nicotine with oral contraceptives, because smoking can increase the risk of cardiovascular problems. Look at all these body systems affected by nicotine. The nervous system increases alertness and the ability to focus. You can feel relaxed and lightheaded. Cardiovascular system, increased heart rate again, and increased blood pressure. The endocrine system, you can have an increased metabolic rate and a reduced appetite. You can have dependence on nicotine, of course, physical and psychological, and it happens pretty quickly. There are a lot of unpleasant withdrawal symptoms associated with trying to stop nicotine use. And there are medications on the market that can help patients with dealing with symptoms of withdrawal, and it lists a few of them here. Chantix is the one I hear the most. But users often relapse and go back to nicotine use because of stress, weight gain, and unpleasant symptoms. And healthcare providers should strive to remain free from impairment due to any alcohol or drug addiction. But interestingly enough, healthcare provider substance abuse, up to 15% of medical professionals will misuse drugs at some point in their career. Alcohol is the most commonly abused legal drug, and prescription drugs secondly. So if you Google online nurses who have abused medications or stolen medications, that incidence is increasing greatly. Why is that? First of all, increased stress for healthcare professionals, right? Due to the demands of just healthcare in general. Social environments among medical professionals that promote self-reliance and independence, that can be associated with drug and alcohol abuse. Also, difficulty sleeping. Look at the people that are working rotating shifts or working the night shift or odd shifts. That can be another reason for drug and alcohol abuse among healthcare professionals. And overall fatigue is another big one with healthcare professionals because they work long hours, odd hours, stressful hours. So all those things can contribute to drug and alcohol abuse with healthcare professionals. Signs of impairment if you're working with someone and you see some of these signs of impairment, you might suspect some sort of substance abuse, frequent mood swings, irritability or tearful outbursts followed by depression, smell of alcohol on the breath, frequent absences from the unit, calling in sick, and patients complaining of not receiving medications. That's not unheard of, that the medical professional's supposed to give a patient medication and they didn't get it because the healthcare professional took it themselves.